for the exam will be very close to the questions for the exam will be very close to the plan that we studied in the class.
Sure,
So
but the answers, it will be so long, so long. It's not short answers. So can you make it smaller to have time to prepare it before the exam? Something like 50, or
I
you
will
can
give
send us
you
100 with the answers.
instructions how to prepare. So what you should point out and what
You will
information.
send the questions with the answers or just the question?
I will send the questions, and also I will send you instruction about the answer plan, like what you should include in your answer, and what you have to learn by heart, and what you have to just know and be aware. So
Okay.
in short, you have to learn by heart the names of the drugs,
Mm-hmm.
Okay.
like classification that you learn by heart, by groups. So, for example, uh, if you take the antibiotics, you should know that the penicillins, and then you list all penicillins: benzyl penicillin, ampicillin, oxacillin, and the amoxicillin, ticarcillin, piperacillin, and this, and then cephalosporins, and then you list all cephalosporins, monobactams, etc. So this is the classification, and then also the pharmacokinetics, like the way of administration and the dosage forms and the elimination of the drug. And you don't need to learn this by heart, but so all the rest you don't need to learn by heart. So just to be familiar with, so you
Just
can.
the classification, right?
No, classification you learn
No.
by heart, but all the rest you should learn
No,
just
about the learn by heart, just the classification and what
yes,
else?
yes, just a classification by heart.
Okay, sir.
So and then the uh, indications. You should list all the indications and describe in short, describe shortly uh, the diseases, and then the mechanism of action of the drugs. Sometimes it's clear, like you don't need to explain, but sometimes you need to explain it in detail. That depends on the drug.
And in the oral way, sir, how many questions will be? Maybe two on the billet?
It will be about 5 questions.
Ah,
I see.
So like we have the different sections. Like for example, first section is the general pharmacology. So and there will be one question about from the general pharmacology, like what is the pharmacokinetics, what is the pharmacodynamics, what is the what are the types of the doses, so what is the eliminations phase, so etc. So everything that we learned in those 2 chapters. So and then uh, the second question will be from the section autonomic nervous system. So that will be cholinomimetics blockers, or adrenomimetics, or adrenoblockers. So one of the 4 questions. And then the central nervous system is the third section, and central nervous system uh, there are plenty of the diseases like epilepsy, the Parkinson's disease, insomnia, and depression. So that will be one of them, and then you describe all the drugs for this disease. And then the fourth will be the cardiovascular diseases. So they will be one of the diseases of the heart, or the vascular. Uh, and then the last will be the antibiotics. So one of the topics from the antibiotics, or the other infectious diseases, and also the cancer, that is today's topic, cancer treatment. So and also the toxicology. So this is in short the all the chapters that we learned during the class during the last three semesters. So and every topic is actually in your textbook. So and also there are lectures on every topics. So it will be easy for
Yes.
you to prepare.
Okay.
So let's begin.
Yes.
So which are you have you read the chapter anti-cancer drugs?
What chapter?
Anti-cancer drugs.
Mm, wait a minute. I need to be sure. I started to read it, but I
Baha, I'm not
not read
asking you.
it.
I'm asking mostly Allah and Mustafa and Bushra. I know
Okay,
that
that's good.
you did not.
Wallah, sir, I usually read more than them, but you don't believe in me. What should I do?
No, I don't believe to you anymore. I
No
mean,
need, no need. That's good.
I don't
Just give
believe
me.
that you can prepare for the class yourself. So I think you need a help to prepare.
Sir, please again the name of the chapter.
Anti Anti-cancer drugs.
Antitoxin.
Good thing, Baha, you are speaking now in English, not in Russian.
Sir, I always speak
No,
in English.
first year you couldn't speak in English, only Russian,
Antihatemic drugs.
and also the Arabic, of course, Arabic.
Sir, Arabic is a beautiful language.
I agree.
Arabic is
I agree.
the
Yeah,
language of romantic and of the love. I can't stop speaking Arabic
I,
because
Baha,
I
I
am a
don't.
lovely guy.
I think the Arabic is not the language of love. The French is language of love.
No,
Isn't
sir,
it,
sir,
Bushra?
sir, sir.
Am I right, Bushra?
I will ask you a
Yes.
question. Okay, sir? Sir, I will
It
ask you a
should be
question.
we. Okay. Baha, and I think the Arabic is the language of Quran.
It is the language of Quran, but this language contain everything. When you want to describe something in Arabic, you can describe it in thousands of ways. That's why Allah is choose this language. So that's why when you bring a woman and put Arabic man speak with her, she will fall in love because this is our language. But for the French, they have only we, ah, we. She want to understand amour, l'amour. They have only l'amour. شنو l'amour?
Okay. But
Amour. Amour.
Amour,
Not
Baha,
naughty.
amour.
Baha, your pronunciation in French is far away from the perfect. So,
Far away from the French.
Sir, sir. If really was the French, it is the love, okay, language. Then why there is no serial French is popular? Why no films
Baha,
French is
the
popular?
love is not about the TV movies.
La
And
Seloti.
Baha,
Yes.
have you ever heard about French kiss?
First kiss. أوائلي.
French kiss.
French kiss.
French kiss. Sir, it is an old. This update is from 19. We are now in the 21st century.
Okay, and now have you ever heard about Arabic kiss?
Yes, sir.
Sir, Arabic kiss. We don't have one kiss.
We have
This
three
kiss is
kisses,
for
sir.
French. We have four kisses. So see, this is the problem of the French. They stay on one thing, but Arabic never stop. Always continue.
So you know, in our countries, when the woman see another woman, her friend, she's just between the women. The men, they didn't do anything like that, but the women, they kiss each other like 30, 25 kisses.
Wallah,
Like
wallah,
that.
sir, this is normal.
Okay, but not French kiss actually. So it's in
French
many
kiss with lips, but
in,
Arabic kiss with heart.
okay,
Huh?
but in many cultures,
Yes.
the kisses are like very common. Like in Spain, for example, they kiss each other, even the different sexes, like men and women. So that
You
is
don't.
culture. So that is not language. So that is different thing. Okay,
Yeah.
let's return to the cancer, because the cancer will not select the culture or the language. So and cancer is the same in the same languages, and the drugs are
Yes.
also the same. So that is why you should learn that. So what do you
Yes.
know about cancer?
About what?
Cancer.
I Cancer. Yes.
Yes.
Well,
I know a lot actually. You can just ask.
really a lot.
So what drugs are used for cancer treatment? Which
I don't know
Uh,
a lot.
it's the chemical drugs. It's they use it for. Or you mean the tablets and something like that?
What are the names of the drugs or the groups?
Uh,
Well, what was it again? It's like anti-cancer drugs. There is some like these drugs.
Yes, anti-cancer.
Yes,
mm-hmm. It's like
like
Xylod, sir,
fluoro.
or
Huh?
Xylod or Fludara, right, sir? Or I'm not.
Fludara.
Fludara, sir?
Fludara.
Fludara.
Uh,
No, no.
there is a fludarabine. It is,
Chemotherapy.
yes. Fludara is actually
Chemotherapy.
yes, it is chemotherapy and anti-metabolite group. So that's
Yes.
Well,
right.
as
And so it's like antibiotics, Bilonaxan
I read
or
the anti-cancer
Illinois.
drugs, which is it.
Baha, please wait when Mustafa will complete the answer.
مصطفى
So then
خلصت يلا.
we will.
Or antibiotics, they use it for anti-cancer drugs like Illinois, Binoxine, Illinois,
Yes,
right?
yes,
Or
right.
I'm not.
Benexine is actually bleomycin, is an
Yes,
antibiotic, and it is used frequently. And uh, the the difference is that in Russia it is not is bleomycin. So bleomycin. So actually, the generic name. So because we don't
I
have.
just remember what we have in our pharmacy, actually.
Mustafa, you will not believe, but we have the same here. So
Uh,
the cancer drugs are moreover equal and the same in different countries, because there are not so much of them, and the cancer is actually the there are not so much companies that produce the anti-cancer drugs.
and so we can find in Asha like Tixol. It's Paclitaxel. It's I think it's inhibitors.
What again?
Taxol. I remember it.
Taxol?
Taxol. Yes,
Taxol, yes,
Taxol.
it is available in Russia too.
Yes, it's in our countries too. It's the same Taxol,
Uh,
but
tax-
it's inhibitors, right?
Sorry? Yes,
It's
it is.
microbial inhibitors. I think it's not antibiotics,
No, it's not antibiotics. Yes, it
yes,
is inhibitor.
but all is for cancer, right?
Again,
It's all for cancer.
yes. The usually for the treatment, a combination of drugs is used,
Yes,
and it usually includes the uh, one of the antimetabolites and uh,
Anti-alkalating drugs.
and another drug of the different group that will not have the same adverse effects as the anti-metabolite. So and
yes,
then
Yes.
there are some cancers that depend on the hormones, and then
yes.
the hormones
Uh,
adrenaline,
adro,
Androgens,
adrenochlorosis. It was like that.
androgens or the estrogens can be used for the treating the hormone-dependent cancer. So,
Yes.
for example, if there is a cancer of the testes, that can be treated with the female hormones because they will inhibit the production of the testosterone that stimulates the cancer development. In the
By
case,
estrogen, right, sir?
sorry,
By the estrogen.
right? Yes, by the
Yes.
estrogen, for example, estradiol,
Yes.
and vice versa. Like the cancer of the uterus can be treated with the androgens, like for example
Androgen.
testosterone,
Yes.
because it will inhibit the synthesis of the estrogen in the body.
Yes.
But this is only for the hormone dependent cancers. Most of the cancers are not hormone dependent.
Yes, sir.
So and there is no complete treatment from the cancer.
Yes. It's just the chemical treatment, but
No,
it's not.
there is no only chemical. There are other ways of the
Yes.
treatment, like the
But sir, they said that the cancer would come back after 4 years. It will not finish.
it will come back after any period, and requires continuous treatment with pharmacological agents, like this is a chemotherapy, and also can be treated by surgery and the X-ray. So
Yes.
unfortunately, X-ray is very toxic. That will lead
Yes.
to the uh,
But
hair hair loss, complete hair loss,
Mm-hmm.
like
But
that
the
is.
surgery, it's almost like just for the women. It's for the breast cancer, right?
no,
Breast cancer can be even in males too, but is
But I
less
mean, it's
frequent.
surgery.
Sorry?
I mean, the surgery, it will be
for
all
the
the.
brain there is a cancer. They do usually surgery. Man, they did it.
For the brain, there is no surgery available, unfortunately.
But I saw like a video in the internet. I was reading about it. It's like there is a cancer in the brain, so like they are starting to cut it with water.
Unfortunately, brain cancer usually is very fatal, so will lead to the death, and
Mm-hmm.
usually the treatment is very non-effective. For the breast cancer, it can be, it's mostly in women because they have more estrogens, and it's very common. So one of the most common cancers in women, and that is why women are required to make an X-ray mammography uh, every year from the age of 35 and older. So and then also they can also diagnose themselves. So there is a very simple guide to palpate it with the hands. So because usually it can be palpated through the skin.
Sir?
The breast cancer can be palpated by the hands, by the patient himself, or by the physician. So, because the cancer with the breast cancer and with any cancer, the sooner the treatment is started, the better. So the better is the prognosis, and survival rate is higher. And actually, the woman can diagnose the breast cancer herself. She just need to touch the breast and to make sure that there are no any hard compounds inside, like because breast is very warm tissue, so like a very soft tissue, so and usually palpating and pushing it a little with the fingers can be easily detected. Bushra? Bushra, do you have a question?
No.
No, because you are the only female left. So, and we are discussing breast cancer now. And you have, if you have any question, then feel free to
You
ask.
should have questions.
No.
No question. Okay.
No, I don't.
Okay, good. So, and there are some drugs that can induce the cancer. For example, the contraceptives will increase the cancer of the.
The level of cancer.
Sorry?
I'm sorry, sir. I mean, I said just increase the level of cancer.
Level of cancer?
No, I mean it's make it more dangerous. Like no, I'm sorry.
Sir, I have a question. What about the antibiotics? I mean,
One moment, Baha. So, Mustafa, you mean the drugs can increase the probability, right?
Yes.
Okay, good. So that's true. The drugs themselves, they don't induce cancer, but certain drugs can increase the chance. It's all
Yes.
by chance. And actually everything, like cancerogenic substances are also, they don't guarantee that the cancer will be 100% after the intake of these cancerogens, but that there is often a probability because there are special anti-cancer mechanisms uh, that prevent the cancer development in our bodies. So we have a system to fight the cancer, but sometimes it will fail and then the cancer will develop. Baha?
sir, was asking about the antibiotics. There is a psychotoxic of antibiotics. Can you explain this for me, please?
What antibiotics?
No, it's like antibiotics. If somebody have a cancer, they use sometimes like a cytotoxic of antibiotics.
Cytotoxic?
Yes.
Oh. So all the
For example,
anti-cancer,
the blemosin.
all anti-cancer drugs are cytotoxic.
Huh? What?
All anti-cancer drugs are cytotoxic.
Yes, I just want to know. Can you explain for me for what effect of them? For example, if we have the blemosin and what is do, because I couldn't understand this information.
So for the anti-cancer antibiotics, usually the mechanism of action is affecting the DNA, and there are special DNA parts that will code the genetics for the cancer. So there are pro-oncogenes. So there are special type of the genes that will develop cancer, and that is why the drugs that influence the DNA that are antibiotics, they are also effective against the cancer. So they all of these antibiotics will influence the DNA.
So it's like they are sometimes do oxidative damage for the DNA or the RNA scientists.
Yes, they usually some damage to the uh, translation or transcription of the DNA,
Ah,
and that leads to the death of the uh,
patient.
tumor cells. So the cells that will lead to the cancer are tumor cells.
Yes. And is that gonna make like sometimes trauma?
Of course, they have adverse effects, not trauma, but
Uh-huh.
so the adverse effects are the same as for the other antibiotics.
I see. Understand you. Okay, thank you, sir.
You are always welcome, Baha. But please don't. Actually, smoking is also increases the
Yes,
lung
yes. Tell
cancer.
Mustafa. Tell Mustafa, please. What smoke
Why?
do?
Why, Mustafa? Baha.
He is smoking a lot.
And you?
Smoke. I I smoke. I don't smoke only like shisha, and it is one time in the month or like this.
Okay, so
And I just take a story for an Instagram, and that's all.
okay, so the lung cancer actually is more frequent in those who smoke. That is why if you want to live long, then I recommend you to quit smoking.
Yeah.
And the
For
throat cancer is from smoking too, sir.
Sorry,
Throat cancer.
front?
Yes, sir.
What is a front?
Throat.
شنو مصطفى اللي ثرون كانسر
Throat.
ما عرفت.
Injury.
Injury.
الحنجرة.
Throat. Oh,
Throat.
throat. Okay, I see. Oh, yes, of course. But the lung cancer is more dead. So
If-
it's more fatal.
Yes.
So more
Yes.
dangerous. So and more frequent actually. So that is why the treatment is very complicated.
Mhm.
Okay. Other questions?
No, sir. Everything is cool.
Everything should be clear.
Clear,
But I
sir.
will check. I will check during the
You
exam.
can ask me if you want something.
I will ask you at the exam.
No, sir. Don't ask me in the exam. In the
So the
exam,
exam,
just give me
the
one answer.
exam, it will be 100% oral. It will not be maybe MCQ, maybe oral. It will be just oral, right?
Just sort of right.
Okay. But it's hard.
So,
Oral is hard.
but sir, you're gonna give us, for example, the question and give us time for preparing. Yes.
Or I will give you a little time to prepare. Of course.
1 hour or 3 hour to prepare.
That depends on your abilities. So for someone it may be less. For someone it may be
Sir, I want 5
more.
hours for prepare. My ability is so bad.
Excuse me, sir.
Sure.
And when you will send us the questions?
I will send them as far as I will
And
prepare
it will
them.
be ready.
Not yet ready.
It's before.
Of course I will send you soon. Like
Okay.
1 month before the exam.
And about the tests, how many tests we have?
Test? Oh, it's 8 tests.
8? No, about the from we had first مصطفى بخا عملت الأول
لا.
كل شيء ما مسوي له.
So the total number of the tests is 8. They are written in the plan.
Okay.
But only first 4 tests are available at the portal. I will prepare the rest soon.
So the test that we are having in the portal, is there any test for me? I didn't answer it yet. So
You didn't answer no any test. So no test answered.
what about the others?
Others they can look themselves on the portal. They should don't bother with the results of the other students.
No, sir. I mean, I don't know. There is a test on the portal.
So now you know. So you should pass them.
But I just want to ask you. Sometimes, you know, my internet is so weak. So, and there is a problem with the portal. So when I go inside the test, in the middle of the test, it just closed because of the internet. Uh, Because this website is a Russian
Baha,
website.
there is no
Ah,
problem. You can continue anytime. There is no time
ah,
limit.
can I repeat it again if I don't have a good?
You can repeat if you don't complete it fully. So when you
Ah,
complete it
yes.
and then you send it for the check, then you cannot repeat. But before you send that for the check, then you can repeat.
Yes, sir. Easy, easy. I will do it. Don't worry, sir. Don't worry on me. I know you are worried a lot of me.
No, I am not worried.
No, sir. You should worry. I am your student.
You should worry yourself.
I'm worried, sir.
Oh, Mustafa
So
can
you
be
just
worried.
broke my.
And how
Ah,
many uh, and how many tests we left? The left.
Depends on the students. So, for example, Allah made more tests. All of so most uh, the 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 highest number of the tests that made is done by Allah, then Bushra, and then Mustafa and Baha.
Allah the Baha. Always in the end. Allah, أنا poor guy.
Baha, I think you are equal with the Mustafa.
No, sir, sir.
So,
There is injustice for me. كمل يا بشرى. Sorry.
sir, but I did. So, how many tests left
You made
uh,
how
for
many
me?
tests you have done?
Yes, I did the first and the second and the third, but the fourth I couldn't.
Okay,
I
so
could.
then you left 5 tests.
No, I did the fifth,
Okay,
and I couldn't find the sixth.
how do you did this the fifth? I because it's not yet ready.
Sixth or fifth?
Third, 1, 2, 3, right?
Yes,
Okay, so there are another 5 left.
but sorry.
Boom.
Then wait,
What
wait.
happened?
I want to ask about the fourth.
The fourth
Fourth, ready
will be
additional.
ready soon. I will tell you when it's ready. Okay.
Ah,
Yes,
sir.
so
Sir, so if we are until now have only 4 tests, yes?
Only 3 tests
Only 3 tests, yes.
at the
But
moment, but there will be more. No, don't worry.
yes, but how can I take them? Ah, this is test number 1. No, test principle for drugs. Ah, therapy. I can't take it now. I
And
finished this.
also, to take this test number 2 and further, you have to pass the test number 1 with 70 or higher.
What if I couldn't pass it? I repeat it again?
If you fail the test, then you have to prepare and repeat it again.
Ah, yes, sir. Okay.
But you should first prepare, because if you don't
Yes,
prepare,
sir. Of course,
you
I
will
will prepare.
fail again.
Sir, I am a good student. اشتاق اللغة الهندية طقت.
That's
not
all.
that one. So where is the test number 1? I couldn't find. It is like in the pharmacokinetics or the drugs receptors or this is test 1. Yes, sir. I find it. No need.
excuse me.
Yes, Bushra, listening.
You told me now how I made the fifth.
No, the fifth is not yet available, Bushra.
Yes, but I did it last year because when you sent us last year to solve our test, then I made a mistake.
Okay.
And I solved the fifth, and you told us don't make mistakes because we have from I think
from the last year. I'm speaking only about this year. From the last
yes,
year.
but the fifth is. Can you please check my portal, please?
Oh, I will check. I think if you made it last year, it was not on the portal. It's not written. it was.
It's written. I got 8.
If you got 8, it is not the test. It is.
No,
So,
it's one attempt, so it's
Bushra.
control.
Okay.
Yes.
It's not control test. It's just
Test.
So there are tests for the class, like everyday tests, and there are tests that have from 1 to 100 that are the section tests. So
Oh my god.
and these are different tests. Don't mix them. So
Can you please check my portal? Just a minute.
I can check, but I'm explaining you. So if the score is from 1 to 10, it is not the section test. It is a small test. Small tests, they will not contribute to the exam. And the only tests that will contribute to the exam are the section tests. Section test is like when we studied, for example, central nervous system drugs, and then there will be all central nervous system drugs. Then the cardiovascular drugs, antibiotics, so large tests, not small tests. And Bushra, you are now talking about small tests. And there are plenty of them. There are about 50.
Yes, I did
small
all
tests.
of them. The small testes.
Okay, but you can check my portal and you will see.
يا
I
أخي
know
check her
what.
portal رحمة الوالدة. Please
Bushra,
search
okay, I
it.
will check. I will check.
Okay.
الله يوديك.
لأنه أنا بعرف شو حماحكي.
بشرى هو ماكو بس 3 تستات.
أنا بعرف بهاء، أنا عم أفهم يعني شو مو غبية.
لا غبية.
حشلات غلطين على الغبي. لا تتجاوزين على الغبي.
And Bushra, please stay after the class is over. Okay, I will check your test.
Okay.
Okay, thank you sir. Have a nice day. Goodbye.
So
أنا راح أظل.
Baha, Mustafa, no questions?
Answer.
No sir. Thank
Okay.
you.
No,
Have
sir.
a good day.
Then
Goodbye.
see you next week.
I like to hear your
See you next
voice.
week. Bye.
I will stay.
Okay. Bushra, and you wanted to check your test. One more.